quest to find innovative surgical techniques has led to many great advances. Today, there are an increasing number of these options becoming available to more people. I'm Larry King, and today we're bringing the latest in medical technologies in view.
As many Americans continue to practice healthier lifestyles, our longevity will only improve. As we all get older, managing orthopedic problems becomes even more important. Orthopedic injuries and chronic ailments, from broken bones to debilitating arthritis and back pain, can rob us of the ability to do the things we enjoy most. Fortunately, experienced orthopedic providers using the latest advanced technology and a complete patient care approach are making a huge difference in our ability to overcome orthopedic problems.
Traditionally, physicians and surgeons were generalists. The surgeon who fixed your gallbladder might be the same surgeon who fixed your broken arm, who may also be the surgeon who did your hysterectomy. That has all changed. We've all become specialized, where your hand surgeon, your foot surgeon, and your joint surgeon are typically different people. If you have more than one problem, you're typically going to multiple locations to be seen by different specialists, maybe going for an MRI somewhere, maybe going for physical therapy. At Shasta Orthopaedics, we've tried to bring all that under one roof, so we can collaborate on your multiple problems, diagnose with your MRI, treat with your physical therapy for the better care of the patient.
From childhood broken bones to the millions of sports-related injuries and the arthritis many Americans cope with, orthopedic problems affect almost everyone at one point or another. As a result of the wear and tear of normal life, it is estimated that 70% of us will have serious back problems. Fortunately, there have been amazing technological advances in orthopedic health care over the last decade.
Traditionally, spine surgery has entailed a large procedure, and patients often anticipate that this is going to be, a major ordeal to undergo spine surgery for their problem. Technology has really advanced in the last 10 years, and specifically in the last 2 years, to allow us to do the same types of procedures through very small incisions. And believe it or not, we're actually doing spine surgery now on TV screens, watching what we're doing and monitoring what we're doing on a TV screen. It's really quite amazing. It has allowed patients to recover in a much quicker time frame. This is outpatient surgery in many cases, and we get patients back to a good quality of life in a very short period of time.
Artificial discs for the treatment of spinal disorders. Computer-assisted total knee arthroplasty for precise performance of knee replacement. Reverse shoulder arthroplasty for the treatment of previously unsalvageable shoulders. These and other recent breakthroughs in treating orthopedic injuries and diseases are enabling patients to live with less pain, better movement, and a higher quality of life than ever before.
At Shasta Orthopaedics, we have a long tradition of staying on the forefront of technology in medicine. We have physicians who have been involved in the development of artificial disc surgery, minimally invasive and computer-assisted total knee replacement, and reverse shoulder arthroplasty. We are able to bring these advanced techniques into our everyday practice of medicine to the benefit of our patients in Northern California.
Traditionally, a worn-out ankle would be treated with a fusion operation where you take the motion out of the ankle joint. In the last 10 years, we've reached the point where we can do total ankle replacement surgery, and that allows us to maintain the motion in the ankle with the components. That makes a big difference for patients. One of my patients is an avid golfer who reported to me last week that he can now play 18 holes of golf without having to pay for it with pain for the next 2 days. It's made a big difference for him.
A frustration for many orthopedic physicians is that so many people suffer with problems that can be fixed or considerably alleviated. Many people have heard stories about surgery complications and poor results that are just no longer the reality. Procedures have improved dramatically in the past 20, 10, even 5 years, providing shorter treatment times and much better outcomes.
One of the most common problems that we see in spine is a disc bulge that basically is pressing on a nerve, causing leg pain. We traditionally do surgery that removes that bulge to relieve the pain, and one of the ways we can do it is through a minimally invasive surgery, actually operating through a tube with a microscope that allows us to go and remove that disc bulge. This is about an inch in diameter, and we've gone from this, just in a 2-year time span, to doing that same surgery on a device and an incision that is literally 1/3 that size. We're able to go in, use instruments that pass through here to go in and actually remove that disc bulge and relieve that pressure. It takes about an hour to an hour and a half to do the procedure. Patients go home the same day and they're back doing their normal activities, usually within 2 to 3 weeks after surgery. And it's really quite amazing. Dave is a perfect example of a patient who has benefited from this technology. Dave came to me with a disc herniation that was pressing on his nerve, causing leg pain. We decided to go to the operating room, take care of this on an outpatient surgery basis. He was home within about 6 hours after surgery. And traditionally, I want my patients to take some time off before they go back to work. In most cases, 3 to 4 weeks. Dave is the exception to the rule. He was actually back to work full time with 3 days after surgery. Truly amazing. I really attribute it to this technology and the surgery that we're able to do to help Dave.
I injured my back several years ago, and it finally got to the point where the pain was basically crippling me from doing anything I wanted to do. I saw Dr. Jones. He did a spine procedure on me. I think the most amazing thing was waking up in the recovery room and all that pain was gone. It was just like a switch. I was able to go back to work in less than a week. It was truly a life-changing event.
Groups such as Shasta Orthopaedics in Redding, California, are an example of providing patients with expert multidisciplinary care for those suffering from bone or joint-related pain or problems. To learn more about Shasta Ortho, visit their website online at www.shastaortho.com or call them at 530-246-2467.